Hello again. There are crazes and passing fashions in medicine and surgery, just as there are in every other field of human endeavour. Such things usually last for a decade or two and are then abandoned because they are judged to be either useless or dangerous. For instance, in the 1930s and 1940s, there was a fashion for treating mental illness by means of the surgery known as the lobotomy or leucotomy. This entailed poking around in the brain and severing a few connections in the hope of relieving the symptoms of severe mental illnesses. The man who developed the procedure, Antonio Mollis, even won the Nobel Prize for Medicine in 1949 for his revolutionary work in this field. Sadly, it proved in the long run to be pretty useless and even hazardous, and so the practice has now been more or less abandoned, although lobotomies are still occasionally performed, even in this country. In the 1950s, there was a positive craze for removing tonsils. This would be done on the most trivial grounds, such as persistent colds in the winter, or even simply if a child was a mouth breather or prone to sore throats. The risks certainly outweigh the benefits in most cases, and so this type of surgery is now reserved for very specific difficulties. Tonsillectomies are certainly not performed wholesale the way they once were. In the 1980s, it was grommets to deal with glue ear. This simple operation enjoyed an enormous vogue in the 80s and 90s, before being almost entirely dropped. Grommets are little valves which can be inserted in a child's eardrum to equalise air pressure if there's a persistent blocked nose causing hearing problems. This was done very frequently in the 1980s, but now it's found that such problems tend to clear up anyway as the child gets older. Grommets are used very rarely these days. Which brings us to things such as elective mastectomies, also known as top surgery, when a woman is convinced that she is really a man and wishes to have her breasts removed. This, together with men having voluntary castrations, used to be rarely performed operations until a few years ago. They were used in very exceptional cases. Then there was an explosion of such surgery. It's probably fair to say that this kind of gender affirming surgery, as it's now called, has become a bit of a craze. Like all such crazes, it will fade away after a few years and return to the situation where operations of this kind are very rare. The problem is that having one's tonsils removed, which used to be done frequently and unnecessarily, didn't really affect a person in the long term. The same goes for having grommets placed in the eardrum. Castration, though, and mastectomies are in a different league and they cause profound and lifelong changes. The best comparison is with that other method of using surgery to deal with psychiatric problems, the lobotomies, which were very popular at one time. Why anybody would think, or would have thought in the past, that it's a good idea to use major surgery to try and alleviate what is, from any perspective, a mental disturbance, is an interesting point. And I think it's likely that in 20 or 30 years, just as we now look askance at the lobotomies that were being performed at one time, people will ask what on earth possessed this generation to mutilate people rather than trying to persuade them to settle down and adapt themselves to society. I think the time will come when we'll look back on what we used to call sex change surgery and now talk of as gender affirming surgery with the same feelings precisely that we now have for lobotomies.